Good evening and welcome to Thailand News. I'm Jessi Lee, here with Jenny Ho, and here's what's making news this hour. In looking at DALIs, experts have just confirmed the epidemiological transition is currently taking place in Thailand. Since 2000, the burden of disease for people ages 0 to 49 have generally been decreasing, but have been increasing for people ages 50 and over. Although the DALIs for infectious and parasitic diseases and for neonatal conditions have decreased since 2000, these diseases and infections still remain as one of the greatest burdens of diseases in Thailand. The experts also confirmed that the burden of disease caused by respiratory infections have increased since 2000. According to the World Health Organization, in 2008, the top 3 causes of death among children ages 0 to 14 are perinatal conditions, congenital abnormalities, and unintentional injuries. As for adults ages 15 to 59, the top causes of death are infectious and parasitic diseases, cardiovascular diseases, and unintentional injuries. And now to Jenny on public health issues.
Currently, there are 3 main public health issues that need to be addressed in Thailand. The first is HIV and AIDS, which has a DALI value of 841 as reported in 2015, where approximately 440,000 of individuals live with HIV within a population of 65 million. In comparison to high-income countries such as Canada, Thailand has almost 3 times as more HIV-positive individuals, and the high cost of treatment results in people opting out of treatment, which results in reduced productivity and creates a burden on economic growth. The second issue is neonatal conditions, which has a DALI value of 442.8. These include conditions such as premature birth, birth asphyxia, and neonatal infections. Some of these may become serious if they are left untreated and may result in permanent disabilities for infants, which will reduce their productivity in their working years and also become an economic burden. Finally, we have respiratory diseases, especially those from tobacco smoking, which must be addressed. With a high DALI value of 1,260.3, taking up 18% of their total health expenditure in 2015. We'll let Mackenzie tell you about the risk factors associated with these.
Thanks, Jenny. Since HIV and AIDS is sexually transmitted, unprotected or risky sexual behavior is a common factor associated with its contraction. Another common way that it's spread is through syringe and needle use, particularly through the sharing of intravenous drugs. The swift urbanization of Thailand's population over the past 60 years has also proven to have a negative effect on the battle against HIV and AIDS, as major metropolitan areas typically show higher HIV and AIDS rates. Neonatal conditions also carry with them various risk factors, including unhealthy weight before or during pregnancy, unhealthy nutrition, and lack of nutrition. The presence of STIs such as HIV and AIDS are also a key risk factor, with tobacco use unsurprisingly having a large effect on the health of the fetus. The most preventable health risk that Thailand faces is that of respiratory diseases and infections, which are mainly caused by tobacco use. In fact, tobacco use is Thailand's most modifiable risk factor, although it is not the only one. Urban air population has also proven to be quite a risk, especially due to the mass globalization and urbanization that is taking place with regards to Thailand's population, particularly due to its rapid economic growth in the past 6 decades.
Thanks, Mackenzie. And now on to Munisha with the action plan.
Thanks, Jessi. To help inhibit HIV from spreading person to person, it is recommended that individuals either refrain from having unsafe sex or use appropriate precautions when participating in sexual behavior, such as wearing a condom. A condom should be worn when engaging in any form of sex. The second issue is neonatal conditions, such as premature labor. To help prevent premature labor, it is recommended that women quit smoking, drinking alcohol, and overall stop the use of recreational drugs before pregnancy or as early as possible during pregnancy. The third issue is respiratory diseases and infections. Respiratory diseases and infections can be inhibited by advising individuals to avoid exposure to tobacco smoke, both from smoking and secondhand smoke. Now on to Amarit for target groups.
So for HIV and AIDS, we need more focus on younger people and men, especially those under the age of 25, those who inject drugs, men whose sexual partners are other men, and sex workers. Neonatal diseases need to focus more on mothers and newborns, specifically those under the age of 5 are at high risk, pregnant women, and newborns that are just a few days old. If investments of $5 per person per year are made, the burden of disease will decrease. Respiratory diseases need more focus on both men and women that are over the age of 80. Right now, the overall cost for a patient with a respiratory disease is $1,495 which is really high. For these diseases, cooperation between government and non-government organizations is needed. National leadership is also needed since there is an increased economic burden for the country. Investments need to be made in the HIV epidemic since they are under-resourced. Universal coverage is needed for maternal newborns, and child health interventions and postnatal care needs to be provided. Operational action policy and strategy is needed to reduce burden of tobacco use. And lastly, promotion of healthy practices need to be present for all diseases.
Thank you for that, Amarit. I'm Jessi.
And I'm Jenny.
Thanks for tuning in to Thailand News.